Dr. Rinaldi, I think I was a while ago seeing or reading something in a Reader Digest about some type of laser, K laser, if I remember it, and it seems to be doing just wonderful thing the way the Reader Digest was talking about. Are you familiar with that?
I am, and I believe what you're referring to is correct. We refer to it as the K laser, but this was something in Consumer Report, actually. What it referred to was the various treatments available to the public for a fungus infection in a toenail. And the article speaks in very simplistic terms, saying that most of the treatments that have been out there over the years this problem has been treated have been only partially effective, those being the creams, those being the lotions, those being the medications that are hyped orally that patients take by mouth. And I may have something to say about that at a later time, the danger associated with those oral medications. But the article speaks very strongly about the most effective treatment today for a fungus toenail, and that is laser treatment. And it goes on to say that laser toenail procedures accomplish what they set out to do 90% of the time. And as a podiatrist, and having seen this in my own practice, it is probably one of the most encouraging things that we can recommend to a patient today to treat a fungal toenail.
Okay. And we talked in other videos that, fungal toenail, number one, it hurts, it looks ugly, and it can have impact on the whole immune system of the body, because after all, it is an infection which by definition travels. And it's in the bloodstreams, and there it goes everywhere. So it's prudent to fix one. So tell us a little bit about why is this K laser so good and so different, and that it's not around all that long, a few years, 4 or 5 years, 3, 4 years, whatever?
Yeah, it's around 3 years. I just want to make one slight correction in terms of the fungus traveling through the bloodstream, etc., that you had mentioned. Certainly there should be no scare to that. It is more of a local problem. And I always tell the patient that to allay their fears. And that's part of my job as a podiatrist. This may be a good opportunity, by the way, to talk about the oral medication, because the oral medication that's taken is something that can affect a patient's body. And the precaution that is directed to our patients is not to take that oral medication, because liver changes can take place and they must have a blood test done every 3 weeks. Now that's the dangerous part of treating an area that may be unsightly, might be painful, but yet is not a life-threatening situation. To address the K laser, yes, it has been out for about 3 years. The reason it's more effective, or has been effective, is because of its wavelength. The way lasers work in its most simplistic fashion is a laser light will penetrate through the areas worked on. In this case, it penetrates through the nail plate, goes down to the nail cells, and the laser light, the wavelength of the laser light is strong enough to take those cells and the atoms that make up the cell and bring those electrons, may sound technical, but it's really not, takes those little electrons and brings them to a higher orbit. Then the electrons, like everything in life, goes back to its resting state. The time from the excited state to its resting state emits energy and oxygen. It's the oxygen that is used to smother the fungal cells. Now, I emphasize the word cells because after a laser treatment is performed, the nail looks unchanged. In our practice, we do it 3 times, by the way. In many practices, they do it once. We like to achieve the maximum success for our patients. But the point is, the cells take 3 months to grow a new nail. It is the new nail that we're after to get the results. And even though my patients, after even one laser treatment, will come back in and say, "Doc, the nail looks a lot lighter. It looks better," I caution them and simply smile and simply say, "Let's wait the 3 months, because that's what we're after. We're after changing the growth place of the nail." I have to emphasize one thing, though. The laser is not something that is covered under any medical insurance policy. It is still considered a cosmetic procedure, and the patient should look very carefully at different podiatry settings and find the best value to accomplish this.
Okay. Well, since you mentioned a little bit about money, and you say you want to give the you don't want to, you do give the patients 3 treatments to kind of like, for sure knock the guy out, that bad, whatever that is. Are you also charging 3 times as much as the other podiatrists?
No, our practice, as you know, we practice in Brooklyn, New York, an area like every place in the nation that's been impacted by the economy. We charge $400 to do a foot, and that is something that we've even now, through the availability of the laser, discounted to $350 per foot, and do that service 3 times. The interesting part of that consumer report will tell you that the average podiatry practice charges $1,200 to do it 1 time. In good conscience, though, we are very happy with providing the service and seeing the results and the smiles on patients' faces because it's affordable, and they can now bring those feet out in public again.
Walk on the beach of Brooklyn. Do you have beaches there?
No, Mr. Flash, we have Coney Island.
Well, all right. Wonderful and very enlightening, and I'm very, one thing I have to say, I really do appreciate sincerely your candidness of, what things are, what they're not, shed the light on it, not trying to embellish and say that, we can do all this and all that, but actually really give us data and information, and I'm sure that the viewer will appreciate that candidness as well. Dr. Rinaldi, bye-bye.
Thank you so much. Bye-bye.